Hey guys, I'm back with part 2 of Emily and Amy. This is the visibility series. So if you're just coming to the Birth Story podcast, a couple of weeks ago, I kicked off a visibility series on same-sex assigned at birth couples, Katie and Jess, Emily and Amy, and then starting next week, we've got Steph and Amy. So in these interviews, I'm digging deep on the fertility journeys and the birth stories. This week is part 2 of Emily and Amy, where we really get into the birth story. But I would love for you to start with Katie and Jess, part 1 and 2. Definitely listen to Emily and Amy's part 1 about their fertility journey and enjoy this beautiful birth story. Let's get to it. What does a contraction feel like? How do I know if I'm in labor? And what does a day of labor look like? Wait, is this normal? Hey, I'm Heidi. My best friends call me Hides. I'm a certified birth doula, host of this podcast, and author of Birth Story, an interactive pregnancy guidebook. I have supported hundreds of women through their labor and deliveries, and I believe every one of them and you deserves a microphone and a stage. So here we are. Listen each week to get answers to these tough questions. Birth Story, where we talk about pregnancy, labor, deliveries, where we tell our stories and share our feelings. And of course, chat about our favorite baby products and motherhood. And because I'm passionate about birth outcomes, you will hear from some of the top experts in labor and delivery. Whether you are pregnant, trying desperately to get pregnant, or you just love a good birth story, I hope you will stick around and be part of this birth story family. Before we get started, I would love to have you guys in Birth Story Academy. It is premier childbirth education for your hospital birth, no matter what the birth looks like that you're planning. So medicated, unmedicated, a wait and see attitude, a belly birth, an induction, there is a module for all of it. And I have a blank name tag at your seat waiting to put your name on it. And the best part about Birth Story Academy is that I get to be your virtual doula. You go into my private Facebook group where I interact with you every single week and cheer you on as you plan and prepare for the birth that you want, no matter what that looks like. So I hope you will go to birthstory.com and enroll in Birth Story Academy today. Okay, so 2 really different fertility stories, like wildly different. I'm like, this is amazing. All right, let's talk about birth though. Okay. So, Amy, I know you are a total freak athletically. And, like I said, I'm over here like gaining 70 pounds and like barely moving, and you're on the side of a mountain, and comparison can be the thief of joy. So I was like, Kaylee, just stop showing me these pictures of your cousin and all of like her amazing athleticism. But like you just said it, right? Like you had a really good pregnancy with Audrey.
Yeah. Yep.
Felt really good. We're super athletic all the way till the end. And you're a PA. Did you have an idea for what kind of birth that you guys were envisioning? Like Emily, did you have, it's Amy's body, but did you guys have a conversation about medicated versus unmedicated? Did you care about what type of birth, hospital, home birth, natural, what were you thinking?
I think from my perspective, you correct me if I'm wrong. I felt like I wanted it to be healthy and I wanted everyone to be safe and healthy at the end. I think I tend to be on the anxious side around those things. And so, that's what I wanted. And so I deferred to her about decisions around like, medication or not, or trying for a natural birth. Did I have an opinion about that?
I don't think you had an opinion about it. And I didn't have much of an opinion either.
Yeah. So
we dropped out of our birthing class because we were so not the people that should be there.
Right.
And we were like,
Yeah.
what's going to happen is going to, she kept saying, let's get a birth plan. I'm like, we don't need a birth plan. Like,
I love
we're gonna
you.
go with whatever they tell us to do, and I'll hold my ground if it doesn't feel right.
Yeah.
That's my birth plan.
Yeah,
Okay.
I think exactly. Yeah. I think, we feel privileged in that we have enough knowledge, I think, to kind of, and power to advocate for ourselves in situations like that. So I think that was kind of our philosophy on that, was that we didn't need everything written down, because we felt pretty confident that we could navigate in the moment. I will say I did want someone there with me. So it ended up not being a trained doula. But, we definitely were of that mindset of wanting, someone there, not for clinical purposes, but for just, support and,
That's all a doula is a support person. They say the Greek term means like woman servant, but I'm like, birthing person servant, birthing partner servant, servant,
we went with our healthcare provider has a midwife group, and so we had early on made the decision to go with the midwife group, and so all of our prenatal appointments were with the midwife group, and we loved them. They were amazing. I think we just felt confident that we were in the right hands. I don't think either one of us were interested in a home birth. I think because, again, my anxiety is like, if something goes wrong, I want to be in a hospital, but, I am fully respectful of people who make whatever decision around that. So, but I think that was the one thing we were sure of, having a doula, and then also so the two things we were sure of, having a doula and having it in a hospital.
Yeah. Who was your doula? Can you talk about this person?
Yes.
Yeah. We did the thing that you do where you choose your closest Orthodox Jewish friend who shouldn't be leaving your house on the Sabbath, and you promise her you won't have the baby on the Sabbath.
Mm-hmm. And then you have a baby on the Sabbath.
And then you start going into labor and you realize, this baby might come on Friday night.
Friday.
Yeah. Yeah.
She was a friend of ours. We've worked with her. She's this perfect combination of just so lovely, so giving, so kind. She has 4 children of her own, and she's a pediatrician.
Mm-hmm.
So we had everything wrapped into one package.
Yeah. She's the perfect person.
Yeah.
You just, your body picked the wrong day. Apparently.
Yes, twice.
Yeah.
Oh, really? No, you're kidding me.
Uh-huh.
Oh my God.
Yes.
Oh, there's got to be a lesson in there somewhere. Oh my gosh, this is really funny. So both times you go into labor on Friday at sundown.
Yeah.
Yeah.
Mm-hmm.
And she's so amazed. She'd gotten permission from the rabbi to be there.
Mm-hmm.
And then we were in our own fog of life, of course, after Audrey was born. And we didn't know this was happening, but it was 101 degrees in Seattle at 1 p.m. when everything was done. And she walked 7.5 miles home to her house because she couldn't drive the car, and her duties on the Sabbath were done. So amazing human.
That is an amazing human. And you guys are so freaking athletic. If I walked 7.5 miles in 101 degree weather, let's just say I wouldn't be here interviewing you guys today. So I know we're telling Audrey's story first, but both labors were spontaneous labor.
So kind of. So Audrey's was, and it dragged on for days.
So she had pre-labor that lasted several days.
Okay.
And it was back labor.
Oh,
and it was agonizing to be in the support position. I mean, far more agonizing for her. I don't want to over exaggerate, but the amount of discomfort was pretty.
It started on a Wednesday morning. I was teaching a boot camp at the time, and I was sending people to go on a lap, and I was having labor pains. And I went to work that day. I was working in a urology clinic, and we were counting contractions. And then I think I had the bloody show at the urology clinic, and so I was like, okay, here we go. And so then Thursday, that night was rough, and then Thursday all day, and by Thursday afternoon, it was every 5 minutes. And she was basically the only position I could be in was doing like a wall sit, and she would have to press me against the wall as hard as she could. And that got exhausting. Called the consulting nurse, and of course they say, well, that's not labor, and you want to scream. They said, take a bath, took a bath, and we were okay. And then Friday all day, it was kind of on and off. And then I'm sure we probably missed this in the birthing classes that we dropped out of, but they said you should have a hobby. Like, so when you're going in this pre-labor, you should have something to do. And we hadn't done it up till Friday afternoon. And that's when Emily said, we need a hobby. we need some shelves still. So let's go to Lowe's and get some shelves. And we're at Lowe's, and I'm on my hands and knees in the battery area, and I'm like
having contractions.
I think it's a little too late to have a hobby right now. So we shortly after that we went to the hospital. And
did you even check out at Lowe's?
We did check out. We got back home. I think at that point, then Amy was like, I'm done. This is ridiculous. They better admit us if we go there.
Don't call, we're going.
Yes.
This is awesome. So the early part, that's called prodromal labor.
Prodromal labor.
Yes. The good thing, you're going to tell me in a minute, but the good thing about prodromal labor is it usually is effective in thinning your cervix, helping the baby rotate into the ideal position, and even opening your cervix a little bit so that your active labor, which is when you're 5 or 6 centimeters till delivery, tends to be a little bit shorter. So like when you have a long prodromal labor, you typically, I don't know, you haven't told me your birth story yet, but I try to encourage my doula clients like, hey, this means your active labor, the hard shit, might be a little shorter, So I don't know if that was true for you, but
sort of. With me, the problem was when I finally, I think it was around midnight, we asked for an epidural and it came at 3. It was a rough go. We had this nurse that had just come from Ireland the day before, and she'd say, what's your pain, dear? And I'd say a 9.5, and she'd say, it sounds like a 6. And so it was a really rough go for a while, and then 3 hours to the epidural. And then as soon as they gave the epidural, we slowed everything down. And then I started having a lot of decels. So Audrey's heart rate was going down. It's funny to say Audrey. She did not have a name at all. The baby's heart rate was going down. And that's when we had Sarah, our friend, come, because Emily was... It was stressed.
Yeah, it was stressful.
Yeah. I mean, they would, 5 people come sprinting in the room all of a sudden to get me to roll over. And I've had multiple epidurals in my life, and they don't go to both legs. So you kind of have to choose, and gravity can take it one way. So I was still feeling a lot. So I think at one point I was on my hands and knees, and they were meeting me in that position. And I heard Emily say, I'm on my hands and knees with my bottom facing the door, and all of a sudden Emily says, oh, hi, Tracy. She's a doctor that walked in, so I didn't know what was happening. But it was when Tracy, this doctor, showed up, I knew we were in a little trouble, because it was we didn't why is the doctor here? We've been really doing well with the midwives, but pretty soon everybody was around, and you were really, really stressed.
Yeah, I mean, I think when you are the one birthing, you're kind of out of it, I think, at that point, and not tracking. But it seemed to be getting really serious in terms of, Audrey's, the rapid decels and decelerations in heart rate. And so, the midwives called for the OBGYN, the on-call OBGYN, to come in and consult. And that's when I was like, oh God, they don't call OBGYN unless it's, serious.
Yeah. But shortly after that, I finally was able to start pushing.
Yeah.
And I pushed for, I think was it 4 hours? 3 hours? Yeah, it was 4 hours, because Audrey was 4 hours and Noah was 4 pushes.
Okay. That sounds about right for a first baby to a second baby. And then epidurals, the average length of pushing with an epidural is 2 to 4 hours. So even when you have some feeling, so the average length of pushing for unmedicated is 30 minutes to 2 hours. So, so that's, you were kind of right in that thing. And Emily, I totally feel you. I mean, these heart decelerations, it's so hard, right? And I've been the birthing person when it was my own child's heart decelerations. And then I've been the doula also as the support person with the heart decelerations, and they're equally shitty. Like it's so terrible, you know, it's just really stressful. So typically though, it's either like cord compression, like like a cord around the neck, or like, you know, a baby's sling on the cord, or it's head compression because you're fully dilated and it's time to push.
Right.
So was it kind of a mixture of both for you guys?
It went on for hours. So I feel like it was a little of both. There was it wasn't around her neck, but I think they just kept like I was compressing the cord. So I think they kept getting me in different positions to release the angle wherever the cord was.
Yeah. I'm pretty sure it was cord compressions. And, you know, and that was the thing. I mean, you know, once the on-call OBGYN came in and like, they all talked about it, and I felt reassured. I mean, it's still, you know, it's still scary, but I definitely felt like, okay, they've been to this rodeo before and they know what they're doing. And
So what time were you at Lowe's?
I think 5 o'clock.
5 o'clock.
Friday afternoon.
What time did you get an epidural?
3 a.m.
3 a.m. And I don't think you pushed for 4 hours.
No, you're right. I was not at those. Not that I'm competitive, but it was definitely not the top end of the curve.
It was. I think it was more in the 2-hour range. And Audrey was born at noon.
Noon. Okay, so that's a long labor.
It was a long labor.
Yeah, I mean, it's still
noon on Saturday.
I mean, so you had long prodromal. I mean, I would still say it was less than 24 hours, which is the average, but it was pretty close to that. So that's a really long time.
Yeah, and it was. Yeah, so we hadn't slept for 3 days, I think, and it wasn't until Audrey was born that we realized that we were never making up those 3 days.
Still haven't made them up.
No.
Nope, never get them back. They're never coming. What, for those that are listening that are getting ready to birth for the first time, what advice, Emily, would you give as the partner? Like what did you learn that then maybe you applied for Noah's birth or something, but on that first time, like if you could go back and say, don't do this thing or do this thing as the partner, what would you do different? Or
I think to let go of any sort of like attempt at rationalization of anything, because, you know, ultimately, like there's no rationalizing what's happening and applying like ration and logic. You know, you just have to like, she's in charge of what's happening and I just have to let go. I think, you know, there was this idea, she's like, wanting to get into the car at a certain time to start driving to the hospital. Like she had very strong feelings about like, this is how it's going to happen.
I didn't want more than one contraction in the car.
Yeah. So, and I'm like, I think it's going to be like, we can just get in the car now. It's going to be okay. I can pull over, you know, whatever, we can make it work. And she was like, no. And I'm like, oh, okay.
Well, then we can walk to the hospital.
Right. Right. Yeah. Yeah. So she had a very strong idea of like this is how it's going to go. And so I think letting go and just trying to be supportive. And then, yes, her needs around like the physical stuff, like she said, it was getting really exhausting, but I just had to like, you know, as exhausting as it was for me, it was a million times more exhausting for her of like
lying backing me into the wall.
Yeah.
Right.
Mm-hmm. Yes.
Yeah.
Yeah.
Was that just for pressure on your sacrum?
Mm-hmm.
That was exactly it. It flattened out my low back against the wall, and somehow that was providing the relief. Yeah.
Mm-hmm.
Got it. Okay. I'm going to interject then. If there are any partners out there and you don't have a doula, and you don't have tools, another thing that feels really good is to get on your hands and knees. And there are the rollers like that runners use to like roll out, or like the old midwives would use rolling pins, but I use one of the runners rollers, and you just go like this over and over and over again on the sacrum. And then you'll never believe this, but because I weigh a lot. I mean, I'm not a tiny person, but I put my clients on their hands and knees and then I sit on their sacrum. It's so easy.
That would have felt awesome.
So easy. It's like I just sit there and like drink a latte and I'm like putting sacral pressure and it feels really good. And they're like, this is so amazing. And I'm like, and I'm not getting tired. right?
Yeah.
I'm not getting
Right.
physically exhausted. But I love what you said, Emily, about surrendering and letting go. But I don't know what I'm trying to say here. Both parents, I wanted to say both birth partners because I'm thinking of the other thing. So scratch whatever I'm saying, Rob. Take that out. Both the birthing person and the birth partners have to surrender when they're becoming parents. So one is typically surrendering physically, right, to the sensations of the contractions and the surges and the pregnancy and all this other thing. And the birth partner is surrendering to the lack of control of, and it's they call it transition for a reason, because it really is transformation. Like who Emily and Amy were prior to that day,
Right.
they don't exist anymore, right? Like,
Yeah.
Absolutely.
I learned that at a taco bus shortly after that.
but like, those are the moments of transition. And I always say, like, if you don't learn it in the fertility journey, you're going to learn it in the pregnancy. If you don't learn it in the pregnancy, you're going to learn it in the labor room. If you don't learn it in the labor room, you're going to learn it day one at home. So like, that's such good advice. Surrender, let go, let go, let go, let go. Okay. I know we've been talking for like an hour and 20 minutes, which is so awesome for me, but like, I can't hang up without knowing the rapid entrance of Noah.
So Noah, when we were pregnant with Noah, we were remodeling our house for most of the time. And so we were living in Airbnbs around the city. And I was in my, third year of being a primary care provider. And so I was getting every virus that's ever been known pre-COVID.
Okay.
And
it's
so
like going back to kindergarten.
Pretty much.
Yeah.
Yep. And we had a kid in daycare. So I had spent probably 3 or 4 months coughing so hard that I had broken a rib. I was 9 months pregnant. I had a broken rib, and I was seeing patients all day. And every time I coughed, I'd have to hold my rib in very tightly, cross my legs so I didn't pee my pants, and then cough a little bit. And I was miserable towards the end. I wasn't sleeping at all. It was that cough where you lay down and you're just going to just have a little trigger cough every breath.
Okay. You have me in panic mode right now, because I'm also like, as a person who sees a lot of things in the medical field, I'm like, I'm like, oh my God, she has a pulmonary embolism. Like, if you're coughing so hard, you know what I'm saying? I'm like, if you're coughing so hard, you broke a rib.
I never had an ounce of leg swelling.
Yeah. I think the only lesson learned there was, why didn't we wear masks back in the day? Like now we all wear masks all the time. Like cold and flu season. I was like, she was in clinic seeing all these people coughing all over all the day.
I think I did wear a mask. So the last day I finally wore a mask. I said, I am going to take the week off. He was due mid-February. Yeah. February 14th. I think we were thinking like Valentine's Day baby.
Okay.
And so I was going to take a week to 10 days beforehand to just take some time off. Because I was so miserable. I said, I need some time. Right.
Yeah.
And so I had a midwife appointment that I went to. The midwife was retiring that day. And so they, like, all the party celebrations were up. There was this whole thing going on, and I was her very last patient. And so I went in, I saw her, things were going okay. And then I went and did the testing, the
monitoring,
the stress testing with the monitor where you sit in the chair. And everything was fine. I left, they had their party. And so, she retired at 5:00. Well, my phone rings at 8:00 and it's her. And I was like, well, didn't you retire? And she said, well, I thought everything was fine, but now I have concerns. I said, okay. And she said,
this was early February, right?
This is February 1st.
Yeah.
Yeah. So on February 1st, she says, I have some concerns. There were some decelerations on your exam. And it seemed like there was maybe too many for me to be comfortable with. I'd like you to go get a ultrasound tomorrow. I've ordered it. And I said, well, I have like 18 patients to see tomorrow. I already have a full schedule. So I got to work early. I sneaked in.
Amy, hold on a second.
Yes.
Difference between you and the rest of the world. I would have been like, okay, I'm coming in right now for an induction. right? Like can't sleep. That's going to stress me out. You just said there was too many D cells. The whole rest of the world is like, get the baby out right now. Amy's like, I've got 18 patients. I need to go to work tomorrow.
Yeah, we're not those people.
Like it didn't stress you out at all?
Oh, it did. It stressed me out as how I was going to handle these 4 things that needed to happen. And I don't know. I feel like many people who go into labor, even it's like the same thing with when could I be pregnant? Like, obviously I knew I put sperm in my body 3 weeks earlier, right? It's this denial. And it's February 1st. We have 2 weeks. We didn't even have a car seat in the car for him. I mean, because 2 weeks is an eternity, right?
Yeah.
So I think there was a little denial that I that's what I do. That's my coping mechanism is everything's perfect until it's not. And I let Emily stress about all of it in advance. And I just have one big day of stress.
Okay.
I got up early. My first patient was at 7:20. I think I saw that patient and I had already talked to the ultrasound people that I could sneak down there at 7:40 and they would do it really quickly for me, kind of backdoor, because I am so privileged to have this advantage to talk to them and get in there. So I did that and they said everything looked okay. And then I think they said, we also need you to go and do the monitoring again in the chair. I said, okay. So I finally succumbed and I said, cancel my afternoon patients. I will see the morning patients. So I saw 6 patients, I think. And then I went to the 3rd floor and sat in the chair where they monitored me. And so I work on the east side of Seattle and all of my care and all of our plans are on the west side of Seattle. It's like 6 miles apart, but it's an eternity apart. You birth at a different place. The midwives are different. Mm-hmm. So they said, they want us to monitor you. I stayed there an extra hour. She called. She said, oh, we need you to do further monitoring. You need to drive over to the west side and go to your own home. And so I went to the hospital. First, I went to our clinic and they said, you're in the wrong place. Go to the hospital. So I go to the hospital.
But at this point, are you like, Emily, I need you to get off work? Or
I called, so I couldn't get a hold of her. She was at a work lunch. And so I contacted the person that she was at work lunch with. She's just not a cell phone person.
This is a theme, right?
Yeah.
So she had to call someone else to get a hold of me.
So I had to call the work person. And I said, don't panic, Emily. Just let her know I'm going to the hospital to be monitored. I didn't want to say anything like anything was a big deal because I didn't want her to be feeling crazy and driving crazy. And so, this was probably around 1 in the afternoon. So then I drove to the hospital and I get in there and the woman starts monitoring me. And once again, this slightly not perfect experience where I said, so what does it look like? She's like, well, I mean, it's not bad, but I mean, it's not good either. So now I panic a little bit. She said, the OB will be down in about an hour, but we'll keep monitoring you. So she left the room. I was by myself. And I think then I was texting you kind of updates. And then the doctor came in and the doctor checked me and swooped. So you swoop membranes? Swept. There's no current tense.
Swept the membranes.
Swept upon my membranes. And it actually put me into labor. So I started having contractions after that. And then I told her, and then she said, we could induce labor or we could not. Like, I can continue to watch this, but I can't really find a reason to keep watching it. Like, you're going to have a baby. We may as well just do this. So then we went from there and they put the balloon in, which I didn't realize that, it's going to feel like you have to have a bowel movement. So I pooped it out about 2 seconds later. Yeah.
But that means you were dilated 3 to 4 centimeters.
Yeah. Mm-hmm. And so then from there I was like 2 or 3 centimeters. And so I was, and our friend Mona came at that time. Mm-hmm. We were going to try to not call Sarah because of the Sabbath thing again. And I did this whole thing around the room. And at that time, the thing that was helping was I was actually squeezing my own hips as hard as I could. And that was helping. Okay. Because no matter what position I put Emily in, for sacrum or squeezing my hips, like it was never perfect, but I could actually squeeze my own hips as hard as I could to get through those. Yeah. And then
I couldn't get the right leverage, but she could get the right leverage.
Yeah. And then I got an epidural with that one. And they said, okay, it's probably going to be, 4 or 5 hours. And at this point, our daughter's birth date is really complicated in terms of all of the different numbers. And now it was February 2nd. And I was so excited. I said, this baby's coming out before midnight because I'm not having another complicated birthday to remember. And
what's Audrey's birthday? Why is it so complicated?
7/18/15. It's just, there's no, and I oftentimes write it, 7/15.
It's just even number, odd number combination. Yeah.
Okay.
It doesn't roll off the tongue,
It did us no favors.
Exactly. You want the number to roll off the tongue.
Gotcha.
Yeah. And
2-2.
And
2-2 is a fun. Yeah.
It's a groundhog. It's Groundhog's Day.
Uh-huh.
Yeah. Okay.
So so then they thought it was going to be hours, and I was like, it can't be hours. And so the doctor left, and the midwife was kind of just roaming around, and it was less than an hour later. And I said, I think something's happening. And the nurse, this time around was much nicer because both nurses working they exercised with Emily.
Oh, that's right. Yeah. So I knew the nurses from my gym, and they were so amazing. It was great. We were having a wonderful time, but yeah, we were,
with each other. I was kind of by myself on the bed doing my own thing, and they were all having such a great time. But
that's what Emily needed. That is what Emily needed.
Exactly. We were monitoring, the readout of
contractions,
whatever was happening, and Amy said something like, "Oh,
I feel something."
Yeah, I feel something. And then we kind of looked, and the nurse was like, "You're right. Like, you're ready to push."
And it was like an hour later. It was an hour after we had. Yeah. So I had
an hour after your epidural.
In like an hour.
Wow. Second babies.
And yeah, we also had, there were, then when she started pushing, there were D cells with Noah too. She didn't push very many times.
I think I pushed 3 times, and then after I had pushed 3 times, they like yelled at me, "You need to push." Like there was no contraction. They said, "You need to push."
Okay.
And I pushed, and he came out, and he was like a deep navy blue color.
Oh.
And they like brought him up to.
Was his cord wrapped?
It wasn't. It was from the D cells, I think. He wasn't wrapped either.
Yeah, I don't know why.
It was compressed somewhere.
Yeah.
We don't know.
Yeah.
It must be my structure.
Just must pinch the cord on the way out.
Yeah. Pincher.
Yeah. Yeah. So and that was the part that was surprising to me. Was clearly they've seen this before and they knew what to do, but they started, like slapping him and,
they had put a non-breathing blue baby on my face. Like I was not ready for that.
Yeah.
Wow.
And I was like, oh my God, they're being so rough with him. But that was, I think that's what they do, and eventually, he started gaining color and thank goodness everything was fine. But that was also a few scary moments.
Just under midnight.
Yeah. Oh, and so it was 2/2. That's my brother's birthday too. Oh, I love it. So, but was any part of your like medical brain like, Noah's fine, I'm still attached to the placenta? You know what I mean? Like he's fully oxygenated, or were you just like, my baby is navy blue and this is really scary?
No.
Okay.
I don't think you're prepared to see that, like it's alarming. And I certainly didn't know. I didn't know all those things.
We were both really freaked out and leading up to that, in the 3 hours prior to that, when I was having the D cells and they'd just finally given an epidural, and it was really based on the D cell. Had I not gone so quickly, I think I would have ended up with a C-section. And they were very much on the cusp of watching that. And at that point, for some reason, I was like, I'm fine with that. Like I was thinking like we need to be safe.
Yeah.
Yeah.
A lot of times too, when they're born that quickly, they don't get that good squeeze.
Right.
Yes.
Right.
Yeah.
To get all that fluid out of their lungs too. I mean, but when you're in a hospital, sometimes these are easy fixes.
Yeah. And I think, and I do think I feel very fortunate that I have very positive associations of being in a hospital. I've never had any negative experiences. And I know a lot of people who are giving birth or doing anything else have had trauma around that. And so that's, not that that's why you choose a home birth, but it's if your brain is hospital avoidant, then, this can be really traumatizing. And I felt very fortunate both times around that, even the first time with a very mean nurse, I still felt very safe and that this was like someplace that I was going to be taken care of. And I know that that's not what all people feel.
Mm-hmm. Yeah. Well, okay, now I have a couple questions before we finish up. And the first is on feeding. So, both of you are women, both of you are able to breastfeed. Emily, did you want to breastfeed? Did you breastfeed? Like, how did the feeding journey go?
I think I did want to try. I think we realized pretty quickly, pragmatically, that was going to just not be a thing. I think we would have had to do a lot of extra preparation to get me in a place. There's a lot of work to do to try to stimulate someone who hasn't been carrying a fetus to produce milk. Mm-hmm. I think it can be done, but there's a lot involved. Or doing, a bottle with a tube, and, kind of, placing it near the nipple and kind of getting that sensation. But it just, I let go of that pretty quickly. I think that's the thing is that I think going into it, you have a lot of preconceived notions about what you'll really care about. And then once it happens, then you kind of realize like, that's not a thing. And so it didn't end up really being a thing after the fact for me. Breastfeeding with Audrey was not super easy for Amy.
I did not have enough milk, mm-hmm. and that.
So I think we had enough work to do around just getting Amy to be able to produce enough for Audrey that like the whole aspect of me trying to work myself into the equation was not a thing.
Yeah. But you did pacify though.
Yeah, I did. Yeah. So just nipple pacifying.
Okay. I did nipple pacifying also with Max. We tried to nurse for 6 weeks. He was lip and tongue tied. It was just hard, but I want my audience to hear that, right? I put Max to my breast for 6 months. Mm-hmm. Listen to me. For 6 months, for a year. Yeah. Even when I was pregnant again with Jagger, there was no milk in there, but that's a damn good pacifier too. Yeah. So, I think a lot of people if we don't say that out loud, not enough people realize it, right? Like you can put your baby to your breast even if there's no milk there.
Yeah. Mm-hmm. Yeah. And, I think it's also important to think about like with all the hormones flowing after pregnancy, like I'm not somebody who internalizes many things as being somehow my fault when they're not. I'm good at it when it is my fault, but I don't take on shame for things that I think is unrealistic or things that even other people do. Right. But even that crept in there of like not having enough breast milk for your baby. And the shame of like having to go to you're doing everything you possibly can to not use formula. And if I could say one thing about the whole birthing, pregnancy, baby making process is just let it go. Like, mm-hmm. If you need formula, just do it. And like, baby's going to be happy and sleep and like, mm-hmm. You're all going to be so much better for it. But I don't know where the cultural norm has been built that we must do this thing or try it, go to hell and high water to try to make it happen, but it's still out there.
Where did it come from? The first person to feed my baby was my best friend Sean. Mm-hmm. She was nursing twins and she came to meet him and my milk hadn't come in and he was like screaming and she's like, do you want me to feed him? And I'm like, yes.
Yeah.
Mm-hmm. And he went right on her breast and like gobbled it up and he was milk drunk and I was like, thank you. And then my milk came in.
An interesting thing our baby daddy, his sister had a baby at the same time. And so she was actually giving us a bunch of breast milk.
Mm-hmm. Very cool.
It was really neat.
This is really important that everyone listening hears some of these pearls, right? Like we don't need to be at all, right? Like formula is fine. Breast milk is fine.
Sharing. And sharing.
Sharing.
Audrey had breast milk from so many different people. And she's got a really healthy immune system.
That is exactly how I feel. Max was fed. He had one main donor for the first year, but then a couple of like sprinkled in donors.
Yeah.
And I remember thinking like, you're getting multiple immune systems.
Yeah.
And if we are meant to live in community in a village,
Absolutely.
like not all breasts are supposed to be milk producing.
Right.
You know, like some of us need to get, like, clearly I was like the hunter gatherer.
Yes.
And Sean was the feeder in the village, you know?
Yeah.
So, I mean.
Yeah, we also had a neighbor who had a baby around the same time. And that neighbor is one of those people that like overproduces, right? And so, they felt wonderful. They were freezing like bags and bags and bags full. Like, what are we ever going to do with this? And, right next door, we had a need and it was so lovely. And
the neighbor was back to her birth weight real quick.
Oh, all the way back. Well, the last question I always ask everyone is, what was your favorite baby product? What is something that you look back and you think like, we didn't need all the stuff, but we did need what? What was really helpful?
We definitely didn't need all this stuff. I can attest to that. There's way too much stuff out there. We were really big. Both Audrey and Noah were swaddled and took to swaddling. And so we had a ton of those, the muslin, whatever they're swaddles. Yeah. And so, but I realized that not every baby takes a swaddling. But
it has been, we've taught people the double swaddle.
Yes,
just making a little soldier out of that.
Yeah.
Hot dog.
Yeah.
And with Noah, they had developed the Velcro ones that kind of do the double swaddle for you.
Mm-hmm. Yeah. And then we had one of those like rocking bassinet things, which I don't know if they've been recalled. So you might not be able to.
Not all of them. Some brands haven't, like the Rocket, I don't remember. One of them was recalled.
Shake a Baby.
Mm-hmm, mm-hmm.
But there's yes, Shake a Baby was recalled in 1932. And then Docatot, maybe that was one of them. I don't know. But yes, you guys, they're recalled, but there might be one out there that's ethical still.
My number one is the exercise ball, because sitting on the exercise ball and bouncing, and that every time any neighbor baby, our babies, even my mother at 70 plus was able to sit on that thing. And the second you start doing that gravity defying bounce, the babies just
they are out.
Yeah. And we spent a lot of time, we carried them. We didn't do a lot of stroller time. And so I think, having one carrier that is really comfortable, that you really like. And I would say that not each parent is going to like the same carrier. There's a million brands out there. I highly recommend, don't buy all of them. Find people who have one, try it on, and feel how it feels on your back and your hips and everything. And one solid carrier that you really like, that thing, we use that so much. Yeah.
And it's sad when they don't fit into it anymore, too.
Right. It is.
Yeah. It is very sad.
Yeah. Well, Audrey still fits in it. I don't know what you're talking about.
Yeah.
Maybe on the back. So, well, you guys, I've loved talking to you today and hearing about your fertility journey and then your birth stories. For any queer couples that are following this series, is there any... Now, I'm not going to say, is there any? I'll give you time to simmer on it for a minute and then I can cut all that out. But what parting words of advice do you have for queer couples looking to conceive?
I think it's the same as any heterosexual couple or any single parent, is talk about it, find your people. we went to this queer conception group and we met, there was only one other couple there and it was this new thing and it was very strange, but we went once, but we met this couple and then we became friends on the journey with that couple. And sometimes I know that can be hard because then that couple gets pregnant before you or after you. And we actually got pregnant at the exact same time, but it's like everything with pregnancy. It's like not having enough milk. It's like having postpartum depression. It's talk about it. Find your people on the journey.
Mm-hmm. Good advice. So, well, thank you guys for being here today. Okay, before we go, if there are any couples that have questions for you or want to reach out to you, what's the best way to get a hold of you?
I would give my email address. My email address is orbitfit, ORBITFIT @gmail. And I would be happy. I think after we went through this, we just really, we wish that this information were available and ready. And, even, where do I find a syringe and just what size, anything, like we're totally happy to help because we felt like we had to reinvent the wheel at every step and that shouldn't be the case.
Mm-hmm. Thank you. Okay, so orbitfit @gmail.com, and that was Amy answering that question. So reach out to Amy and Emily at that email address, and please give Noah and Audrey a hug from Kaylee and I and Max and Jagger. Thank you guys for being here today.
Thank you so much, Heidi.
Thank you for being part of the Birth Story family and listening to this episode. On Tuesdays every week are doula diaries, little snippets and tidbits from my week, along with some teaching and education. And then on Thursdays, we meet here for our birth stories and our expert speakers. So thank you for being here and listening to the podcast twice a week. And if you are left wanting more, like Heidi, I've listened to all the episodes, I've read your entire book, then I hope you will meet me in Birth Story Academy and let me be your online childbirth educator to prepare you for your hospital birth, no matter what that looks like. Thank you for listening to Birth Story. My goal is you will walk away from each episode with a clear picture of how labor and delivery might go, and that you will feel empowered by the end of your pregnancy to speak up, plan, and prepare for the birth you want.